I'm Dr. Winifred Booker. I've been practicing pediatric dentistry for 30 years now. And I got started as a pediatric dentist I was working with a general dentist in Baltimore City, and because I was so tiny and I wore a ponytail all the way down my back, they started referring children because their adult patients complained and wanted to know how old I was and how long I had been practicing. And so the two general dentists that I worked for always instead scheduled children for me. So when I went to Meharry, they always had us to have a healthy Halloween party every year and Grandparents' Day. So I had a healthy Halloween party in that community, and we got droves of patients, which helped me decide to do a pediatric dental residency. So even after doing the residencies, though, I could not get in front of all of the tooth decay and disease that I was seeing. And I said to myself, I'm never going to drill and fill my way out of this, something that has been repeated in the profession. And so that's when I came up with the concept of the Brush Time Bunny, which was followed by the program Lessons in a Lunchbox. The Brush Time Bunny is for younger children, 3 to 5, and then I came up with the concept of the Lessons in the Lunchbox program. Take your rinse cup off first. So the reason I came up with these products was that I practiced in inner city community. I mainly practiced with patients that look like us. And so the children, even though I was doing lots of stainless steel crowns, lots of pulpotomies, lots of amalgams and composite resin restorations, the children were still coming back with recurrent decay or even more disease. And what I realized is that it was more than about teaching them about oral health, but it was also about teaching them about diet. And that's what both the Brush Time Bunny and the Lessons in a Lunchbox was designed to do, was to empower the child. And while it empowers the family too, it was geared toward the classroom, that is the Lessons in a Lunchbox program. And so here I am, 30 years later. I do pediatric dentistry. I ultimately, because I came up with these products, I had to open a toothbrush company, which is today called Brush Time Enterprises. And I couldn't afford to buy them for every patient that I wanted to touch and get them to. So I opened a nonprofit organization called the Children's Oral Health Institute. And just to tell you a little bit about the Lessons in the Lunchbox program, it is a oral health education program that's designed for the classroom. And it is to help give an adjunct to the teacher, because here in the state of Maryland in 2012, we got legislation passed that requires every public school in this state to teach oral health education in the classroom. And so this is something that teachers can go online and they can register a school for the program during the month of February typically. But it teaches about oral health, about flossing and brushing. You notice I said flossing first and then brushing, because if you brush and then you floss, you got to brush again.
Yep.
So I teach it the other way. And when I walk you through the practice, you'll see some of the charting that we do or the posters that we have. And then it teaches about diet, my plate. And this is a free domain. The government does not mind you using it at all. And then, as you can see, we have the endorsement or the support of organized dentistry from the Society of American Indian Dentists to the Academy of General Dentistry to the Hispanic Dental Association and our National Dental Association and the women that we are amongst in the profession. We have all of these generous sponsors, and I'll tell you a funny story. When I first came out with the idea, I did a bunch of cut and paste because I imagined who were the strongest corporations that would help me. So I put their logos on the back of the lunchbox. And I called them and said, can I meet with you like at the Chicago Midwinter, like the ADA that's going to happen next week? So Steve Kess from Henry Schein, which we know is the largest manufacturer of dental, medical, and veterinarian supplies in the world, they had said, okay, we'll meet with you. They didn't know who I was. And they canceled the meeting 3 times. I saw him at a breakfast at the Chicago Midwinter meeting. I had a lunchbox with me. He gave the opening welcome address and left the room. I followed him. He went into a coat room. I went in behind him and shut the door. And I did my dog and pony show just like I'm doing now. I explained to him what this was and all of the features of it, how it had a mirror on here that told the child, see yourself becoming a dentist. If you can dream it, you can be it. If you can see it, you can be it. If they can see you. That's why we like dental students to do it. I mean, I'm older, and maybe you can relate to me if you're brown, because I'm brown. But if they see your youth and that you're going to be a dentist, then they can dream it. They can see themselves becoming a dentist. And I showed him that, and then I showed him dental care in a carrot. And he said, I'm in. And every year they give us $5,000 times 10 years, $50,000 to date. And then we came up with this, or I came up with the dental care in a carrot case. So what the children told me with that first model is, we don't know what to do. And then so once you leave the room and you are not there anymore, the teacher may or may not go back to the program. So I decided to put the images in that shows them how to floss, the amount of toothpaste to use, and all of the steps that you should take to brush, and that you should rinse as well and brush your tongue. I decided to put a mirror in it because once it separates from the lunchbox, there is no more mirror. And so we recreated it. But last year we had 4 deaf schools sign up and 1 blind school. So now the carrot has Braille on it. And we also have a lunchbox that's in full Braille. The rinse cup tells the child now, it says rinse cup inside, and it says screw cap on the bottom. So now they have everything if they're independent from us having presented the program. So that's kind of the quick and dirty of who Dr. Winifred Booker is. I come from a family of 8 children. I'm the 5th girl born.